So what we're going to do for the rest of the session, for the next 15 minutes or 20 minutes or so, is actually have an open house and roundtable discussion with all of the panelists here who are present. And it's an opportunity for our audience members to also share any questions that you have, whether it's about sexual and reproductive health or about any of the topics that were discussed today. And I did see that Pankuri, did you want to ask a question? Would you like to share?
Yes, I'm sorry. I think I preempted you. My question essentially was that we've seen that the Indian standards of care also exist and SOC 8 is about to come in. So I technically feel that there's been a lot of delay in these changes reflecting in the medical curriculum. So we as students really want to know why is there this delay? Why at a super specialty level do we get to know about these interventions or about these care procedures and not at an undergraduate level?
That's a big question, and I think I almost heard two parts to it. So one is sort of why is there such a delay in updating the standards of care to reflect perhaps a more modern thinking about what they should be, what the standards of care should be. And to that question, Dr. Schechter might have inside input on this, but I think it's this has been a long process to update the standards of care, and I think it's because there are so many questions where we don't have strong research studies that give you a one single clear answer, and so you end up with people of different backgrounds and different points of view that then have to kind of get together and agree on what the standards of care should be. And I think that has been a long process. I will also say that my understanding is that the upcoming standards of care 8, they are going to be a much more comprehensive set of standards compared to the previous version. And much more as where there is evidence, much more supported by the evidence than referencing the evidence. So it's been a very big project. I did hear you also allude to, why are we learning about it now as medical students and, practitioners? Why didn't we learn about this in undergrad or in high school or, in primary school? And I think that is a big societal question. And I will say that is a pendulum that is swinging on a societal level, really, at least in the US, to more and more exposure. And I think the fact that there's more discussion about transgender issues in TV shows and on the news, that did not happen 30 years ago. And so I think by necessity it will become more something that is being discussed and also something that our students are demanding to learn because it really is something that they've heard about and want to learn more about.
So I have a question for all of the panelists. I specifically noted this in Dr. Hammondvick in your presentation. You described that a lot of the care, gender-affirming care, is done by subspecialists, so endocrinologists or maybe surgeons as well. And you also really pointed out the need for primary care physicians, pediatricians, ancillary health professionals, nurse practitioners to be adequately trained in this as well. And I'm also thinking of our future surgeons here who might want to be specialized in this type of support. So where do we get training? Where do we get support? How do we go about that process?
Yeah, and this is something where the surgeons have really taken this question and problem and done something with it and created real training programs, as Dr. Schechter was mentioning in this talk. I think the number of surgeons that are being trained in these programs still needs to be higher so that we can meet the demand that is out there. But they are happening in surgery. In medicine, and Dr. Knudsen, you can also comment maybe in mental health, there has not been any formal training. So this is something that WPATH has really taken up as sort of its main educational program is the Global Education Initiative, where they really provide a lot of a lot of training, both in the form of lectures, in the form of mentorship, and in terms of also giving opportunities to hearing the patient voice. So there are sort of these kind of worldwide global training initiatives. But I also think that I get invited more and more to talk about these topics, not to so much endocrine programs. I get asked to talk about it to primary care programs, to OB/GYN training programs, to family medicine programs, because they are the ones that have recognized that they need to be part of the solution.
I just like to add that what we are seeing in India also, that now general practitioners are also becoming aware. Like, as I told, when I started my practice way back in 2008, that time we hardly used to have any inputs from general practitioners. But now we are seeing that many of my patients or clients who come to me, they also follow up with their doctors and they are interested to know what we are doing. But also to add that they don't really understand in the beginning that what exactly is happening. As the student also pointed out, that there is a lack of knowledge at the level of the undergraduates. So what we are trying to do in our college is, like, we have made a curriculum for MBBS students also, where we talk to them about what exactly it is, what exactly we are doing, and our whole team takes some talks on that, so that we at least prime them that exactly they should know what we are doing, because tomorrow they would be seeing these type of patients in their practice for sure, and they'll be seeing much more number than what we are seeing at the moment. And if they are aware of it, and at least they know, they will be more helpful for them, and they will know what exactly to do for them as well. So I think the trend is changing in India as well, and our students are actually working more with gender dysphoria clients, and my DM students now are aware from day one about gender dysphoria. When I did my DM, we were not so much into this, and we used to see only few patients coming with gender dysphoria. But now, like, my students can easily know the way how it has to be done, what are the guidelines, how it has to be practiced. So the trend is changing, and I think 10 years down the lane, the things will be different, and government is also recognizing that this needs to be a part of the curriculum of MBBS curriculum as well.
Thank you for those answers. I really appreciate it from our panelists. I do see a number of hands raised. So could we actually go to, I see Sheetal?
Yeah, I'm really liking the whole, the way the program is going, and it's beautifully organized. And being a first-year anatomist, I've been teaching anatomy, and the way the surgical anatomy was shown by the surgeon, just the previous presentation, I'm really feeling unfortunate that my anatomy textbooks don't highlight the treatment for transgenders, or a perspective which they can have as a solution. And as the student rightly pointed out, that undergraduates are completely unaware. I feel we have a long way to go. I just needed to make a point here that the way we have disability inclusiveness, if we have the transgender inclusiveness, I feel is the way forward. We need to make the atmosphere in colleges very welcoming for them, because still a lot of stigma is attached. And I feel that stigma comes out, even the medical faculty, I don't know whether they are still ready to hear from somebody. Like, I remember the introductions of my first year students, they say, I am this, and I'm this, that. And I wonder whether the third part of the introduction, we are ready to take it in a positive way. So I was just wanting to know, in the global scenario, how inclusive is your medical education in terms of making them comfortable in the campuses? Whether you have them facilities which make them very welcoming, because I feel in India, we have still a long way to go. So if we can imbibe the rights from you all and, work on a certain level, and I'm sure, as ma'am rightly said, if she's introduced the first year students very well, it should come into the curriculum, and our textbooks should be, looking at it in a different way. So a long way, right from the medical faculty to common people getting aware about it. And I thank, Pimde sir and everybody who has been doing this great work today. My holiday has become more meaningful. So thank you so much. Amazing work. Thank you. Thank you.
I request Dr. Gale to take on the question that ma'am asked.
Do you mean the question more about what is going on in terms of medical education? Yeah, okay. because there are a few comments in there. So I think it's, and Dr. Schechter and Dr. Hamdick can also kind of talk about a European perspective and an American perspective. In Canada, it depends on what medical school you go to. So Canada, as you know, is very large, and each province has its own kind of medical climate. And so each medical school or faculty kind of has their own program in terms of whether they are going to teach about trans and gender diverse people. So a few years ago, there was, I think it was about 3 or 4 years ago, there was a meeting that was held in Minnesota, and it was in Dr. Eli Coleman's program. And they gathered people from around North America that work in sexual medicine and transgender health. And they also did a survey of programs within North America, and they found that only 1 to 3 hours of the undergraduate programming in all of undergraduate medicine was to do with sexual medicine and transgender health. So we have such a long ways to go. As I said on the last program, I think we're a bit more fortunate in British Columbia, where I live, and that's just because we have a sexual medicine program for many years, since the 1970s. And so we were able to have a bit more influence when they were changing the curriculum, that we have, some sexual medicine and transgender health programming, but not nearly enough, as Dr. Josie was saying earlier, not nearly enough. So thank you.
I will just briefly also add, just on the part of like, how do we make our transgender students feel welcome? And, this is, faculty members in probably most medical schools are not on top of this, but the students are. So we have had a lot of student activism in our medical school here in Boston, that basically, we had silly things, like we had single stall bathrooms that were labeled male. It's a single stall bathroom, like this should not be labeled male. And so, those were changed to be gender neutral. And, we have had requests for including more content specifically on what we've been talking about today. So that's been done. But also we have sort of made an effort of just putting in occasionally that, a patient presents with chest pain. Well, the patient was assigned female at birth, but is a transgender man. And it turns out that has nothing to do with the chest pain, but 5% or 3% or 2% or 1% of your patients will be trans, and so that should be reflected in our readings. So even small things like that, I think, helps kind of raise awareness and to some degree normalize the discussion on gender identity.
I had one point, one innovation I wanted to share with the audience. Actually, at UCSF, we had in our residency curriculum, we had about a month of transgender medicine, which was really, really important. And I think it was extremely necessary, in fact, in our very first year of residency. And during that time, we actually interacted for several weeks with standardized patients. And so these were transgender and gender diverse individuals who would give us feedback. Are you actually speaking in a gender sensitive manner? How could you improve? And yes, I think doing those types of, being in those situations, having those experiences even earlier on, I think even before residency, is very important. But at the minimum, I think in residency, in all residencies, that should be a mandatory requirement for training. And I left that rotation. I think all of us felt we need so much more. This was nothing, we need so much more. So yes, I think that's something that I hope we can introduce in all of the medical colleges and all of the residencies in India as well. That would be great. So I think we have a question for Dr. Schechter that came from the audience and was sent to me. And it was really just wanting to know a little bit more about surgical training and how do we go about receiving training when it comes to gender affirmative surgeries.
Thank you very much. So to answer the question, probably to a degree from both US and perhaps European perspective, surgical interventions, gender-affirming surgery, it doesn't include one particular specialty. So it may involve plastic surgery, urology, gynecology. While there is probably increasing exposure at the residency level in each of those fields, it's our opinion, or many people's opinions, that for the more complex procedures that generally involves either genital procedures and to some degree facial procedures, that post-residency training is recommended. There are a variety, a number of fellowships that have been developed both in the US and in Europe. They tend to be accessible to trainees from either plastic surgery and or urology. Now, there are also interventions, surgical procedures that are really an extension of what is done in standard residency programs. So for example, for top surgery, specifically breast augmentation or mastectomy, most, probably all residents in the US completing a plastic surgery residency will have some degree of exposure, perhaps not in individuals with trans experience, but will have exposure in varying degrees, either for cisgender women for these procedures. The evolution of that, or the extension of that to individuals with trans experience, the learning curve is much shorter than for the more complicated genital procedures. So from that perspective, educational offerings, seminars, I think people, observerships, going to visit a surgeon for a short period of time, surgical trainees can get up to speed pretty quickly on the more, quote, standard or routine types of procedures.
Thank you so much for that answer. It was very, very helpful. And I know, Dr. Kumkum, thank you for your patience and waiting for us while you had your hand raised, and we'd love to hear from you as well. Go ahead, ma'am.
Sure, I will. I think one of the students had a question about why it isn't included in the educational curriculum. And I just want to encourage the students, because I am an alumni from Lady Harding Medical College. And I'm very proud of the fact that our principal opened this meeting today. And Dr. Shobhini Rajan, who is the director or assistant director, something at NACO, another Hardonian, is in charge of the transgender care in India. As you all know, that there's been a TPPR or some act that's been passed, and it has to be translated into action in India, and she's leading the effort. And one of the main things she is focusing on, among other things, is medical education. So it is coming. She cannot do it overnight. We've got a lot of medical colleges in India, but she's right on top of it. So all we Hardonians should be very, very proud that we are leading the charge. It's the right thing to do. It's human, it's compassionate, and good luck. Thank you.